Okay. So we'll wait just a couple minutes to let everybody into the webinar. It looks like we're at about 20. Welcome, everyone. We're at 45. Awesome, a great crowd here. We're at 75 here. Okay, so it's kind of trickling down. Hi, everyone. Welcome. My name is Kelsey Doom. I'm the President and CEO at the Brookings Area Chamber of Commerce, and we're really excited to bring you this awesome webinar for you. Al Heuton is going to be our moderator and host today, but I just wanted to start with a few housekeeping items. Down in the bottom of your Zoom, if you scroll to the bottom, there's a button that says Q&A. If you have any questions throughout the webinar, click that and submit your question through there. If we get through everything, Al will go to that section and go through the Q&A that we receive. This will be recorded, both audio and video will be posted to the website. So if you wanted to share it with anyone afterwards, that would be awesome. And then in addition, we have these industry roundtables that we're doing every Tuesday and Thursday at 10 a.m. Today was medical. Tuesday is nonprofit, and then Thursday, I believe, is personal services or professional services. But and then on May 5th is the manufacturing roundtable. And so if there are businesses online here that maybe have more questions, or maybe you've tried to implement an idea that you learned today, you want to learn more about that, hop onto that industry roundtable. The link I can put in the chat here so that everyone has that. And then the last announcement is this afternoon at 4 o'clock, we have our first virtual chamber mixer. So if you want to hop off this Zoom and grab a cocktail and then join us for a mixer at 4, I'll be sitting here in my couch and we'll be having some fun, playing some games and learning from each other. So I'll put that link in the chat as well. So without further ado, I'm going to hand it over to Al Heuton. He is the Executive Director for Brookings Economic Development Corporation. Al, go for it.
Take it away, huh? Thank you, Kelsey. Appreciate the opportunity to be here to help guide the webinar. First, I'd like to say good afternoon to everybody that's out there listening or watching. I want to thank you for attending today. As Kelsey mentioned, this is a webinar on COVID-19 preventive planning. It's being sponsored by Brookings Area Chamber of Commerce and Brookings Economic Development Corporation. So I'm going to serve as a moderator for today's discussion. That means I get to leave the heavy lifting up to all of our panel participants. So today for this webinar, we have several major employers from the Brookings area that are going to share how they're creating safe workplace environments in their businesses to be able to keep their employees healthy. We've got a great mix on the panel, representatives from manufacturing industry, agricultural processing, and healthcare. So a good mix of people with different backgrounds, different types of industries to show how they're implementing safe practices. You know, this has really turned out to be a very timely discussion. I think everybody has been paying a lot of attention to the news, what's taking place, particularly in Sioux Falls with the meatpacking industry and the havoc that is creating in their community. You know, and that is causing a lot of people in the Brookings community to start asking questions about how safe are our bigger industries. So I think this is great timing to be able to have our major employers on this type of a panel discussion to share how they're keeping not just their business and their employees safe, but also how that translates out into helping to keep the community safe. So I think you're going to hear a real clear message about the proactive measures they've been taking. Over the last few weeks, our staff has had quite a bit of contact with the major employers and others in the community. They've been extremely proactive about how they've been implementing processes to remain safe. They're going to continue to do that. So I hope that really helps to put a lot of the community at ease about how things are being taken care of here in Brookings. So this is going to be a great opportunity for everybody, I mean, the panelists alone, just to be able to share with each other what they're doing, but then also for everybody that's listening. We realize these are larger industries, but I think you're going to hear a number of the practices that they are implementing are going to be things that you can do at a smaller business as well. So there should be some good lessons for everybody. So to kick the discussion off, first I'd like to welcome our panel members. Certainly appreciate you taking the time out of your busy schedules to come on here this afternoon and share your ideas and what you're doing. I'm going to have each panelist introduce themselves, and then we'll get into the questions that we're going to be asking. So Dale, you're in the top corner here, so do you want to go ahead and, well, at least on my screen, hope you're in on everybody's. So you want to start, Dale?
Yeah, thanks, Al. Like Al said, my name is Dale Tidemann. I'm the plant manager at 3M, and I appreciate the opportunity to be on this panel and share what we've been doing at 3M.
Somebody go ahead and jump right in.
Hi, everyone. My name is Sarah Perry. I'm Vice President of Corporate Affairs at Falcon Plastics. And also, as Dale mentioned, looking forward to sharing and also learning from the panel that we have assembled today.
I'm Albert Patin. I am the Safety and Environmental Manager here at Daktronics. To second and third what Dale and Sarah said, we're here to share information that we've been able to implement across our organization to protect our employees, but also to learn from everyone else and continue the process of improvement.
Hi everyone, I'm Dan Beinhorn. I'm the Vice President of Manufacturing and Engineering over at Larson Manufacturing. I too want to thank Al and Kelsey for the invite. Looking forward to the discussions and the dialogue, and certainly will very much appreciate any questions from the other participants. So thank you again for letting me participate.
Hi, I'm Tom Kersting, CEO of South Dakota Soybean Processors in Volga. Certainly interested in hearing everybody's ideas out there on what to do. I'm sure some things that I haven't thought of, so I'm looking forward to that today. Thanks.
And I'm Stacey Erickson. I'm the Vice President of Quality for the Avera Health System, so not actually directly out of Brookings, and so I appreciate the opportunity to be part of your panel here today.
Great. Well, thank you for the introductions. As Kelsey mentioned, we've got a series of questions we're going to ask the panelists to discuss. When we get through with those, we'll take as much time as we have for questions from the audience, and I see we've got a couple there already. So to kick off the questions, I hope all the panelists have that list of the order we were going to go through with questions. Who's first? If you don't, I'll prompt you. So before we get to the first question, Avera Health Systems has put out a guide for employers on how to work with this COVID-19 issue. I thought it'd be good to have Stacey Erickson talk to us a little bit about what is in that document, where you might be able to find that if you're interested in it. So Stacey, would you go ahead and just kind of cover what you have in that document for us?
Sure, I'd be happy to. And this document is available for anybody that wants to use it. And I did give it to Kelsey to just distribute to the Brookings group so that people did have it. If you don't, you can reach out directly to me and I can get that for you. Otherwise, it's out on our Avera.org site. It's very important for us to partner with the employers in our communities, because the safer your employees are, the fewer patients that we're having to treat with this very strong illness. First of all, on the very first page, it's important as employers that you're screening for symptoms of your employees when they come in. The screening is new cough in the past 14 days, and that's new, so it's not your people who have an allergy cough and those kinds of things. There's been a lot of confusion there. But new onset of cough in the last 14 days, new shortness of breath in the last 14 days, and fever over 100 degrees. We would really recommend that you are screening your employees for temperature when they do come to work. We know that people need their paychecks, and we've had people try to get through screening stations and not be honest about the cough and the shortness of breath because they really needed to be at work. And the fever is just something that employees can't hide. So inside this document, you're not only going to find some good information for safety measures within your own organization, but we've provided you with a few posters that you can use in your facility. One specifically around the proper way to wash your hands. I know that seems like it should be pretty self-evident how to wash your hands, but We used a lot of pictures because we know many of our industries have non-English speaking people working for them. And so even though they're written in English, we have tried to also make pictures available for folks. In partnering with employers, one thing we're coming to understand that it's really important that as leaders of your organizations that you encourage employees to stay home when they're sick. It's a little bit counterintuitive because we want to have really good attendance at work, and we have a lot of good Midwestern South Dakotans who come to work when they're sick because that's what we've done for the last couple hundred years. But today they really do need to stay home if they're sick. Considering offering paid sick leave is important for employees, but I realize that's a financial component that you have to talk about within your own boards and organizations. The federal government right now does not require sick notes, and so it's important for employers to be aware of that and not be requiring the sick notes, because Avera actually right now isn't writing the sick notes either. We're going along with the federal government with that one, because we'd be writing sick notes like we'd have to have somebody doing that all day, every day. Another important component from the infection control perspective is when can an employee come back to work. So we do have guidance in the document for you there as well. They do need to be fever-free for 72 hours without taking a fever-reducing medication, and they must be 7 days away from the first day that they had symptoms. And so people wonder, why do we screen for cough and fever or new cough and new shortness of breath for the last 14 days, but yet we let somebody come back to work within 7 days of having the illness if they're fever-free? And that's the difference between screening somebody for risk factors and actually then having them return to work because of the absence of true symptoms. So it's really two different components, but that does cause some confusion and wondering why workers aren't off for the full 14 days when they can come back after 7. The rest of the workplace, just some little tidbits. There's several bullet points in here. I won't go through all of them because you've got a lot of panelists here. But one thing that, even though if you can social distance in the workplace and keep your employees 6 feet apart, the break room, people forget that you still have to social distance in the break room. So, you know, not eating lunch in groups of 4, you've really just lost all of the work that you've done to try to social distance out on the floor and in the workplace if you have 4 or 5 people gathering at the same table for lunch. So be really aware of what's happening in your break room. Make sure you provide hand sanitizers or places for people to do hand hygiene within the workplace. Those are the high points. If somebody is sick, it's important to go home and be on home isolation. We do have some tip sheets for you on how to properly isolate yourself at home. People get very afraid if they have a family member who has COVID-19, how to stay safe and still live within the same home. So we have that available in many different languages for anybody to use that. And then we do describe social distancing. If you have the news on, hopefully you guys have all heard the rules around social distancing, but we have we've added a poster in here for you and different information. The last thing I want to hit upon, and then I'll hand it back to you, Al, is the use of cloth coverings or cloth masks. A cloth mask provides source control, which means I'm the source. And so if I put a mask over my own face, I'm controlling my source of droplets. So COVID-19 is spread by droplet contact. So you get a drop and then you touch your face. And so wash your hands, don't touch your face. But when you have a cloth covering on your face, it means it's keeping the droplets from you from spreading to other people. So that's why if you're going to do cloth coverings, everybody in the organization should do a cloth covering, because you have to protect the droplets from between 2 people, not just one person. So if I wear the mask, I'm not providing my own safety, I'm keeping the rest of you safe. So you would want to remember that when you're doing the cloth masking, that everybody should wear them to be in the safest environment possible to reduce that source control.
Yeah, well, thank you, Stacey. That's just a very informative document that Avera has put together. So I would encourage all of you to get on the Chamber website. It would be located on there. Lots of great links within the document on masks, hand washing, social distancing, other resources and wellness resources that you might pass on to your employees. So we've got a series of questions that we're going to jump into here. I'm going to ask each panelist to shed some thoughts about what they are doing in their particular business. related to each question. And then at the end of when each industry answers those questions, I'm going to ask Stacey if she has anything else she'd like to add on that particular topic as we go through, so we can continue to hear from the health expert that we have online here. So Sarah, you would be the first one to speak on the first question. So we had just talked a little bit about managing sick employees. And how do you do that in this changing environment? Have you had to adopt new personnel-related policies, things like that, to help control sick leave? So if you could share about that, and then we'll run through the list. And again, if you don't have it, I'll call on you. So go ahead, Sarah.
All right, thank you, Al. You know, some of Stacey's comments about influencing employees to stay home when they're sick, especially for us in South Dakota, we're pretty darn tough, I think. And that was one of the first challenges that we realized early on, is employees ignoring some of those symptoms, or, hey, I'll be fine, I'll be this. And then even our managers accepting that. So right away, beginning of March, we looked to really change that dialogue in our facilities within our departments, and really got out there and said, stay home, what are you doing here? That wasn't commonplace in our workplace. We left it up to each individual in the past to make your own decision. You're responsible for your health, make good decisions, right? Now we've taken that to a completely different place, where our managers, our supervisors, those are interacting with their team members, they are sending employees home. And that was not something that was custom in our workplace in the past. So, and now our employees, I think, also have gotten accustomed to, okay, I know if I go in and if I have a fever, if I have some of these symptoms, that I'm going to be sent home. So we're finding that we're not having to do that anymore. The workplace culture has really changed, and people are being very sensitive to that. So they're not even walking in the door. Even with that, we are taking steps to do some of the temperature checks and the employee screenings that Stacey talked about. The biggest challenge there is sourcing of thermometers and some of the PPE supplies. We're diligent on that. We've been patient, so our employees are aware and understand the protocols we're going to take as soon as some of the last supplies come in, which is hopefully going to be end of this week or beginning of next week. One of the other things that I think really helped our workforce become at ease, and also some of our managers, is we put in a return to work protocol. It's actually a screening that we worked with an outside agency to work with our managers and our employees when someone went home sick. Even if that employee wasn't suspected to be COVID-19 carrier, if they were at home sick for a period of time, we would refer them to this agency as a resource. It is a nurse that talks to them about their symptoms, helps educate them on a lot of the things that Stacey was talking about their symptoms, and then helps them prepare for those return to work protocols. Again, Stacey highlighted very, very well. That has not only given our managers some comfort that this nurse and also a physician in this agency are looking over that case, they're studying the symptoms, working with that employee, but that employee also has the opportunity to have this medical resource, which we know right now our hospital and clinic systems are challenged to provide that kind of care in the way that they would normally want to. I'm sure Stacey could probably chime in more on that. But this is an agency that has those resources that's not directly tied to a clinic or a hospital system, and is proven to be a really good resource for everyone involved, employees, managers, and the like. Al, you talked a little bit about policies. You know, we have taken the stance at Falcon Plastics, regardless if you have symptoms, if you live with someone that's high risk, if you yourself are high risk over the age of 60, or if you're just fearful, we are allowing those employees to not come to work and extending leave policies. We're also extending policies that allow them to retain their health insurance benefit for up to 12 weeks without having that eligibility jeopardized. So really looking to be as flexible as possible with all of those things. So employees are comfortable staying home. when that's appropriate for them and for their family and any extended family that they might have that they come in contact with.
Great, thank you, Sarah. Lots of good ideas there. Dale, we'll jump to you next at 3M. You're still muted, Dale.
Thanks, Al. Sorry about that. So here at 3M, we do have our general policy, which we have really stressed with our employees, that if you are sick, we want you to stay home. We have lifted all the penalties and removed that pressure to make sure they don't feel that pressure to come to work when they should not. It's caused some other challenges, but we've worked through that case by case. 3M as a corporation has also implemented another policy to provide people an opportunity to stay at home if they're not sick. So if they are sick, we're using our standard 3M sick time benefits. So they can go home with pay. That's one of the benefits that we have. So we take advantage of that if they're sick. We did set up a special program for people that are not sick, but we need them to stay home. For example, if they're quarantined or if they have a sick at-risk family member, we're taking the precautions, keeping them home, and we've got them covered with this separate program. And then, of course, all employees with flu-like symptoms are in contact with our OHN or our plant nurses on a regular basis. So even if they're not likely to be COVID carriers, if they're home with flu-like symptoms, we're in touch with them on a regular basis. We did also set up the temperature screening, so everyone coming into the plant must have their temperature screened. We invested in a non-contact thermal imaging camera system that is working really well. And it has, I think that's been one of the most positive things we've done. A lot of positive feedback from our employees that they feel protected by that, knowing that nobody's going to come in and work beside them and while they're running a fever or having a temperature. And then, of course, we've done really locked down the plant. Only people essential to operations are allowed into the plant. Very strict restrictions on visitors that would come in only if they're essential to help us keep operations running. And then anybody who can work from home and do their job effectively is working from home to minimize the number of people we've got coming into the building.
Hey, great, Dale. Thank you. Tom, you want to jump in?
Yeah, not a lot to add. We run a continuous process at STSP. The plant never shuts off, so it's difficult to have a lot of flexibility with people. We need people to show up. It's important. We have had a lot of conversations with folks as far as some may have symptoms and you have to make some judgment calls. It's very difficult. It's very difficult to put together a one-size-fits-all policy for these things. Just commenting on Dale's comment about outside people, we put together a very extensive outside contractor review process and safety protocols, things that they have to follow. It's almost like another level of training that they have to go through before coming on site. So those are some of the things that we've done at STSP.
Hey, thank you. Albert, what would you like to add that's taking place at Daktronics?
Well, not to say we're already doing all the same, but there's a lot of similarities that we're doing as industry to make sure that our most important asset, our employees, are safe when they come to work. The change in narrative in regards to having employees typically come to work needed to change. Employees with any illness, health effects whatsoever, were wanting them to stay home. And like Sarah said, it is a change in mentality, but we started that very early on in the beginning of March to change the narrative where employees are encouraged to stay home if they're having any health symptoms, whether COVID related or not COVID related, because we want to build a workplace that encourages folks to stay home if they're ill, but also encourage those other coworkers that the facility is safe and that we're doing everything possible to keep their safety while at the facility. When we look at that too, a lot of our policies and practices in regards to staying home if you're ill are very similar to what Dale and Sarah had mentioned, that it is not held against them. We want to get that encouragement fashion going where there are going to be feeling safe by staying home and not feeling any retaliation of doing so. Also, with our practices that we've done, we have had a couple opportunities. As you all know, we have a facility in Redwood Falls, Minnesota, and that facility for a state closure, we were closed for 2 weeks. We have implemented a very similar practice, a return to work procedure for any employee that was gone out of the facility for an extended period of time, whether or not it was related to health symptoms or is related to the state shutdowns, and the same screening type of questions that we're all familiar with were utilized for those employees. We are also doing temperature testing. We have a pilot process going in one of our facilities already, and we've been running that for about a week and a half right now. The biggest challenge with that is developing a process and a procedure that our folks can follow to make sure that they're safe, but also to make sure we have defined guidelines when those employees need to go and seek medical treatment. So that's been very well received. And like Sarah said, getting instruments and equipment has been difficult, but we've been slowly getting them trickle in and adding onto our system and getting more of that testing completed. Another thing that we are doing, and what one of our questions we'll talk about later, is social distancing. But one of the things that we've helped us with the narrative of sick and ill employees is we do a contact tracing form within our facility. We've been doing that for about 3 weeks now. And we are requiring that our employees document any exposures within that 6 feet. We originally were using the Ireland and UK timeframe. This is actually something we borrowed from our Ireland factory before it became common here. And we've been honing down and using that tool for 2 things: is to help us if we do have an exposure to validate who has been in contact, but also help us identify processes and procedures. So it's a very good tool that we've used, and it's helped reduce and mitigate exposures. One thing Stacey mentioned I got a second on too is the behavior change for lunchrooms and cafeterias and break rooms. We're all creatures of habit, and we like to follow the same process and procedure. So that's something that we had to do very early on, beginning of March, is separating out lunchrooms, providing limited number of chairs at tables. We've also taken it a step further too, is parking lots. Parking lots are another area that we may forget, but is an opportunity for employees to gather, and following those same processes there and tying that into our contact tracing forms, that's still potential exposure. So just kind of a little bit of overview of what we've done.
Okay, great. Thank you, Albert. Dan, what would you like to add from Larson Manufacturing?
Well, as Albert said, I don't want to say same, but we've done a lot of the same things. Early on, we put together a COVID-19 leave policy, and it was designed specifically to encourage the behavior that we were looking for. And that's, of course, if somebody's not feeling well, they need to stay home. It really made the decision for people to make, made it pretty easy, because they could make that decision without any risk of their job. And in a lot of the absences, we were providing pay. So we addressed people who had the virus, that people who may have been exposed to the virus, people caring for somebody, caring for children, feeling that they are high risk. And we even included those people. I think one of the panelists had said this, that just people display different levels of anxiety during this pandemic. And for those people that just were not comfortable leaving the house, we took care of them also. And so basically there's absolutely no risk of losing your job. And we're really encouraged people to make those right decisions. We also, in the policies that we've put together, such as this COVID policy, we've been really clear with people that these are living documents. Things are changing, feel like they're changing still so rapidly that, especially early on, it was exhausting. I mean, the discussions that you would come into for the day, either an employee question or something that a coworker read, and we're really clear that that the policies and what we are putting in place, those are going to change, because as the CDC offers new guidance, as we see different legislation at the federal and state and local level, we're gonna keep those documents live. The other thing that we found really important is that from our leadership team at all sites, and I don't know if everyone's familiar with Larson, but we've got major manufacturing sites in Minnesota, Iowa, North Carolina, Mississippi, and we've got smaller sites in Utah, Wisconsin, Ohio, Missouri, Pennsylvania, and Texas. And so we started very, very early on as a crisis management team, and our focus was really about educating and sending out a consistent message. So even if we had developed a great procedure in the COVID policy, if we didn't communicate it correctly, we wouldn't have generated the behavior that we're looking for. So all in all, we are extremely pleased with what our people have done in terms of when they're not feeling well and not coming to work. And that's also part of the fact that it's like all of us manufacturers that everyone needs to do their part. And we've been really clear and very transparent that we as leaders have a responsibility, and everyone in every position in our company has a responsibility to make sure that the workplace is safe. And it always comes down to that weakest link. And we just I think we've done a nice job with that policy and how we rolled it out. And it's been well received.
Great. Thank you, Dan. So we've had some really good comments there and lots of different types of practices that have been put in place just in dealing with sick employees. And I'm going to change up a little bit since everything's changing every day anyway. We're going to change how this is working. So we have some good questions that have come in, and I think maybe I'm going to throw some of those out first to the group, and then Stacey or any one of you could answer these, and then Stacey will ask for any additional comments maybe after the questions from you. So some of the questions that have come through, are you able to share the policies that you've developed, to cover all these different areas? And if you are willing to, maybe if you could just send those to the chamber and we could get those posted. There were questions on the type of thermometer that you use to test temperatures and where would you find those at? So can somebody answer that question?
So this is Dale Tidemann with 3M, and the one we are using, I mentioned, is a non-contact thermal imaging system. We worked with a company by the name of ICI. I couldn't tell you what that stands for, but I'm sure if you Googled it, you could find it and look at the system that they're using. I know that they've got a lot of systems in airports. They were working with us and with Ford Motor Company, but about the same time we were putting these in multiple 3M sites around the country. They're also putting quite a few of them in Ford plants as well.
Requires contact, make sure that you're following the cleaning instructions in between employees. So that's a step 2 that gets missed. Even a forehead, you do need to most generally wipe it with alcohol, but your thermometer will have some instructions for how to clean it.
Okay. Tom, we had a question specifically for you. With all of the truckers that you have come into your plant, are they allowed to get out of their trucks, or do they remain in the truck while they unload and then leave?
Yes and no. As far as soybeans coming in, producers, elevators hauling soybeans, we're fortunate enough to put in a electronic ID cards, so that kind of reads the information. They no longer have to pass documents. When they get out at the pits, obviously they're isolated. We don't unload the trucks for them. As far as the product guys, a lot of our meal customers, those guys do get out of their trucks. There's information that has to be passed as far as paperwork, bill of ladings, those kind of things. What we did, instead of having an open access to the loading office, we put a door in with a slot to pass paperwork back and forth to reduce that contact. The other sections, we have requested that truckers remain in trucks, and then we come to them and get the information, versus prior to that, they would come into a office type area and exchange information there.
Okay, great, thank you. Anybody doing anything different with truckers as they come in?
We're not. I mean, we're limiting access of services. We've got different entry points for deliveries that have to come into the plant. A lot of times the people that come into our facilities are regular drivers that we know pretty well. And so we've just restricted all the access from anybody coming in without going through the front office area.
Mm-hmm.
Okay. Oh, go ahead.
I was going to say, we've done the same thing as Dan described, and then as we implement our temperature checks and screenings, those that we can't otherwise restrict, will also be going through that process.
Okay, thank you. There were several questions here about masks. Are you requiring all of your employees to wear masks on the job site? Whoever would like to answer that, go ahead.
I can give that a start because we've had a lot of dialogue about this, and Albert, you'll appreciate this because you taught us a lot of these things. But when we started to address the virus as it really ramped up, and I mean it was quite intimidating with the amount of square feet that we were trying to cover, and we just went down to the basics that we do as manufacturers every single day if we have a hazard. And that's, we look to engineer it out. We look to create new processes and procedures and administrative controls. And if we can't fix it with that, then we go to some type of personal protective equipment. So in our facilities, what our first step was to make available masks for anybody that felt they wanted to use them. And going by what you were talking about, Stacey, it was really it was really for their own comfort, whether that really made a difference or not. In the job, we do have a handful of jobs, none here in Brookings. We've got a couple in Iowa, and we have a couple in our Mississippi facility where we haven't been able to figure out how to separate people. One site has a very large paint line, and it's loaded. It's an extrusion facility. It's loaded and unloaded in the same spot. You've got about 5 or 6 people all working in a fairly tight quarters, and we mandated masks in that example. So right now, that's where we are holding right now, because all the other places we've been able to abate the hazard by creating that distancing or creating additional barriers.
Okay, great. We also had a question for Albert. Would you be willing to share your contact tracing form?
Yeah, we would be able to definitely share that. And kind of on the line of the cloth face covering, I echo what Dan's saying right there exactly, is that following those social distancing, engineering the hazard out, and the employees providing masks or in this case, cloth face coverings, providing them for their comfort if they feel that it's necessary, but really driving on the engineering side of things. We've been kind of interesting too is, as you all are aware, we have really 2 sides of the business. We have the manufacturing side and we have the construction, installation, maintenance standpoint. And so we have seen in communities and locations where these communities will require cloth face coverings as part of the job. And that's made us do some adjustments on how we handle those construction standpoints. We're still push the social distancing. We still maintain the 6-foot requirements, but we've had to provide these for that side of the house because the state and local municipality requirements.
So I'll just add a little bit. We've been also testing and working with face coverings, really ditto what Dan and Albert have already said, first focusing on that engineering. But in light of the CDC guidelines that came out over a week ago now, really encouraging this. And then even as you look at your return to work protocols for employees who've been sick, they're strongly advising wearing of face coverings in those situations. And the challenges that come with making sure people understand how to properly put on, take off, store, dispose. We're working through all those things right now. It is our intent, once we can source enough face coverings, to do an all-employee requirement for that. One of the challenges as we've been testing this is Our employees also wear safety glasses throughout most of our operations. And what we're finding, and I can see Albert shaking his head, he knows what I'm going to say, they start to fog up. So we are working on anti-fog spray, wipes, and testing out different masks to see if we can find the right combination, because we don't want to add another safety hazard on top of the current circumstances. But we do think we're getting close, and I would welcome, Dale, if you have any comments or anybody else on some solutions there that you have found, or any hints, but we think we're getting closer, but not quite there yet.
You know, I'll jump in here too. And being with 3M, I think it's only appropriate that I talk about face masks, but you know, I think we all run into that same challenge of learning how to position that face mask right, your glasses right, so they don't fog up. You know, it's a challenge. I don't have the perfect solution for you there. You know, I'm sure you've seen in the news, 3M is one of the main producers of face masks, especially the N95 medical grade face masks and respirators for the world. But early on with this, you know, as our sister plant in Aberdeen is the one that's making a lot of those face masks, they are ramping up and doing everything they can to get out as many face masks as they can. All the other 3M plants were asked to do the same things that the rest of you have talked about, is try to engineer out other solutions so we can send all the masks we can to the medical providers around the world rather than use them internally. So we did not have a supply of N95 masks for our own employees. We did the social distancing here. It wasn't until just recently we've actually gotten a supply of non-medical grade face masks that we've made available to our employees. But at this point, it is still a voluntary. We haven't gone mandatory yet. It's still just a small percentage of our employee population that's choosing to use those.
Okay. I've got a couple more questions, and then I'll go ask those real quickly. There's one that I'm going to include in the next discussion topic. So very quickly, if you have, do you have a policy for an employee that doesn't have symptoms but may have been potentially exposed to someone who might have? So as an example, if one of your employees has somebody that works at the Smithville plant in Sioux Falls, would you require that employee to stay home, or would you adjust just based on how they feel?
I can start on that one. We've had Christy Lee is our director of HR, and she's done a really nice job of organizing her team and all of our facilities to funnel into a small group of decision makers when we've got different situations of exposure, and then make that decision. So one example, the answer is yes, Al, to the question, and to the listeners, that we do have procedures in place to handle when a person has been exposed or thought they've been exposed, and that involves a quarantine as well as a return to work protocol. So we had a recent situation out in our Utah facility where a spouse of a coworker tested positive, and so he told us, which was great. I mean, it's got to start there, that we've got to know what's going on. We talked with him on the phone from this site and suggested that he needed to definitely stay home for 14 days and be quarantined. In addition, our COVID policy covered that right away, and so he was comfortable that his job wasn't at risk in that situation. And we've had other minor, no, I shouldn't say minor, but like I said, every situation's different. Early on, it was about travel. You know, we started with overseas travel, quarantine, then it became to domestic travel and where you went, and then it became to no travel. And so it's evolved in terms of what decisions we're making in terms of allowing people to return to work. The best thing is that when we do tell somebody that they can't come back to work, the dialogue has been great. I mean, they're very appreciative. They understand. There's no disagreement in the discussions. And so again, I think that's an extremely important part of what we do in keeping the workplace safe is you know, when people need some help in making that decision to not come in after an exposure, that we definitely can help them with that.
Great. So Stacey, to close out this discussion, did you have anything else you might want to add to this?
Yeah, I just had one thing to add on the mask. discussion, if you do have employees masking, once the mask is on and you got this fogging problem happening, people tend to fiddle with their mask and try to make it work right. So there's a bioburden on the front of that mask. So once the mask is on and somebody touches it, they need to do hand hygiene. You get this level of safety. It's like when you go out in public and people have their gloves on at Walmart. Those gloves aren't adding any layer of safety if there's something on the glove and then you touch your face. So as soon as somebody touches a mask, that should be part of your instructions to your employees that they do need to wash their hands because of the bioburden that does collect on the outside of a mask.
Great, thank you. So we have used up 45 minutes of our hour and a half. We've gone through one question and I have 5 more for you. So we may have to just maybe kind of step up the answers a little bit and make sure that we're not repeating things that have been discussed, but all great answers, great questions, and great questions being posted. I do want one quick comment on masks. We do have, local volunteer groups that are making cloth masks in the community. I had received a phone call yesterday from a group down in Elkton that's making a little different kind of mask, and maybe we can have, we've got instructions on where to find those that maybe Kelsey could get those posted on the chamber website so that people know about those. So I'm going to jump to the next question, and Dale, we'll start with you on this one. So this is all about social distancing on the job. How do you keep your workers separated in the workplace? And then there's kind of a related question to that came through where we've got a business that has people that work in small groups of 4 or less, same people day to day, minimal interaction with other groups. Looks like they get out off-site, for field work and things. They're in a vehicle together. So if any of you have any thoughts about how you might address that type of work group, maybe share those as well. So go ahead, Dale.
All right, and so I'll go down our list of the things we've done to promote the social distancing. We probably put more effort into this than anything else we've done, and it's probably been the toughest one we've done. Like Stacey had mentioned early on, we very quickly redid the layout of our cafeteria and our break rooms. Since all other meetings were canceled and we were gone to virtual meetings and a lot of people working from home, we've used all the conference room space we can to spread out our cafeteria and break room seating, rearrange the table layouts, and made sure that every chair in the place is 6 feet apart. On the work centers where the people are actually making the product, we've tried to re-engineer those and get the spacing 6 feet apart. And where we can't, we've installed a lot of barriers. We've used a lot of plexiglass. We've used a lot of plastic curtains and hung up wherever we can, or we can't get them apart. We're getting a barrier between them. And of course, if we can't find a way to do it safely at 6 feet apart, we will shut the work centers down until we can find a way to do it. Like I'm sure a lot of you are going to say, we've got visual markings all over the place, lines on the floor, X's on the floor marking that 6 feet spacing. The lunch line has lines on the floor 6 feet apart to constantly put those reminders in front of people. But then in the end, it still takes coaching, supervisors out there reminding people all the time, because we just naturally come together, especially in those harder to hear areas where the machines are loud. People tend to just forget and come together. So we have to keep reminding people to go further apart. And I think we start to get more comfortable as time goes on and Brookings County continues to have low numbers. People feel safer and safer, and it's less top of mind, and there's less fear, and it gets even harder for us to continue to remind people how important that spacing is.
Okay, thank you, Dale. Tom, you're up.
Yeah, we're fortunate. We don't have a lot of areas where people are working on top of each other. Certainly we have break rooms and control rooms, things like that. We've had some issues there. Control rooms were, utilizing masks and things like that, things of that sort. We have had an issue with, in bathrooms and things like that. We're asking people to kind of stagger that a little bit. We also had an issue with the time clock, as people like to congregate around the time clocks. We're instituting a electronic or remote time clock where employees can clock in using their cell phones. That's going to be coming in next week. We're going to be putting that into place. They have to be in a certain proximity to the time clock for it to work, but that's one thing we're doing here. But we're pretty good. Like I say, we've got our work load is spread out throughout the plant, so we've been able to maintain pretty good distance with everybody. It's been working fairly well.
Great, thank you. Albert, you're up.
Well, a lot of the things that Dale had mentioned with the marking of floors and looking at our lunchrooms, setting up separate lunchrooms, we call them pop-up lunchrooms to help mitigate a number of employees together. But we've also implemented to help encourage social distancing a zoning system. So every one of our factories have been broken up into multiple different zones, and each one of those zones have specific entrances for only the people that are working in that particular zone. So what it does, it helps reduce the amount of employees that are coming into contact with each other, but it also helps eliminate any of this cross-zone exposures. Then tying that in with the social distance, with the contact tracing form, to help us establish if we've had any contact and also to establish if we have any process changes we need to do. But the zoning has been a huge thing that we've implemented, and we've implemented this in all of our factories domestically and internationally as well. With that, inside those zones, we utilize behavioral-based safety components to continue to audit the work areas throughout the day. A lot of our areas are using the 6-foot social distancing as one of the behaviors that they're reviewing, and then every day we're reporting on what those behaviors are and how we're doing to continue to encourage, because I can't second what Dale said enough. As we continue to see low numbers and we continue to go on weeks and weeks into this COVID-19 process, we got to keep our employees engaged and encouraged to continue to follow these social distancing criteria, not only here at work, but away from work. If we're not following the guidelines and practices away from work, and then we come to work and we get lackadaisical, that's a potential for exposures, and we want to be very vigilant about that. But I would say our biggest elements has been that zoning, and of course with the zoning, we stagger lunch breaks and reduce the amount of employees exposed in particular areas of that zone.
Great, thank you, Albert. Dan, do you have anything you'd like to add?
Yeah, I mean, all the above, to different levels of detail. That, I mean, the same things are going on in all of our facilities. I would just add the piece that Stacey had talked a little bit about not missing the more casual areas of interaction. One of the tougher things is to eliminate the congregating of people. And we talked about the time clock here. Some of our facilities just eliminated the use. We have the ability to keep people in, and we've got the option in certain work areas where everyone starts at once. And so we don't need people to punch in. And it's things like that we put time clocks in for a reason. You think you have to have them, but when it comes to getting creative with this social distancing, you start doing things that you never thought you would think possible. And that's how, I think our mindset has changed through this whole process. Is we joke a little bit about be careful what you say, because you can sound really stupid next week. That's how we've evolved. And I think we're pretty proud of the creativity our group has come up with in terms of the social distancing part.
Thank you, Dan. Miss Sarah, anything you'd like to add on this one?
Maybe just to highlight one other thing. I suspect most are doing it, but we don't share anymore. We don't share anything, from pens at the workstations, bring your own. It got real when the coffee stations got pulled out. Interesting times we're all in, right? But really, some of the things that you just kind of take for granted, we buy bulk spoons, knives, and forks for our break room. So I'd encourage people just to look at those simple things. Well, you don't buy them in bulk because everyone's hands are in those things. So those might be some things just to think about when you start walking around your facilities and looking at some of those shared or common spaces.
Thank you, Stacey. Any additional thoughts from medical community? You're still muted, Stacey.
I was going to share what Sarah touched on there. There's other community items that are used that you need to keep your eye on. Sarah, you covered that well.
Okay. Thank you. So we're going to do more shifting here. We have 3 more questions. We got about 30 minutes left. So I think what I'm going to do is maybe have 2 or 3 of you answer the next question, then we'll save the rest of you for the following one. If we have time to come back at the end for additional comments, we'll do that. So this next question is related to workstation sanitizing or sanitizing the whole facility. How do you go about that? And what kind of practices have you put in place? And Tom, we'll start with you on that one.
Okay. Well, we've covered a lot of these things, but you know, in addition to the best practices, the hand sanitizers, hand washing, things like that Stacey spoke about, you know, we're having each employee, if they have a workstation, before they leave, to disinfect that station in case somebody would happen to sit down there or something like that. We're also having what I would call enhanced janitorial services, where we're, you know, greater disinfecting different areas, doors, light switches, printers, things like this. So a lot more disinfecting going on in the office and out in the plant. We're also trying to eliminate areas of, you know, that could spread infection. Or we find ourselves doing a lot more electronic signatures on documents to avoid transfer of papers and things like this, using email to approve invoices and reconcile documents, where we used to have to, you know, physically sign off and pass those papers around in the past. So those are some of the things that we're doing.
Great, thank you. Albert, would you like to add something to that one?
Sorry about that, I was on mute. Yeah, the same thing is really encouraging cleanup in your individual work cells. We are also requiring clean in, clean out at lunchrooms, break areas by those employees after they've been in the area. We're having increased frequency of cleaning. One thing early on that has been very beneficial for us, those who are able to work at home, were able to work at home. And we did this first part of March. By doing so, then we've also eliminated some additional areas that we would typically have employees in, which allows our cleaning staff to focus in the areas that have more exposure, increasing cleaning in handrails, doorknobs, opening doors to reduce those potential cleaning areas, having sanitizer and sanitized wipes throughout the factories. We also, when we talk about cleaning frequency, we've implemented a risk assessment process for any type of cleanings. And we're doing cleanings no matter if it's COVID related or COVID positive related. And every time we do a risk assessment to walk through the process to determine who's going to do the cleaning, what area needs to be cleaned, what type of PPE we need for those cleanings, what type of communication needs to be done, verification of disinfectants. So that's become part of our process as we work to be proactive on these cleanings.
Thank you. You know, we're going pretty quick on this question, so I'm going to keep going through the list of our panelists. So Dan, would you jump in on this one? And
sure. And again, a little bit of repetitive answers here, that we are sanitizing each workstation. So typically the majority of our people rotate every couple hours, and that each workstation is getting sanitized every rotation. We've got enhanced cleaning, as Tom said. A lot of our facilities work 4 10s or 4 9s and a 4. And so we've got time on Friday where capacity is idle. And so we've got teams that are doing a deeper clean on those Fridays. I'm not sure that it's necessary, but I think at the beginning here, it really added some peace of mind. And as Albert said, that we had to go through and you say you're going to do a deep clean, but you have to really define what that means and how to do it. We've got an emergency response team. We call them ERT. They've been trained and ready to do a deep clean. So if we were to have a coworker test positive, we've got a procedure in place where we would analyze what that person had done, and then we've got a team in place ready to clean. And then in addition to all of that, we've got a national agreement with Clean Harbor to respond with their team if we decide that we needed to have it done professionally, or if whatever the exposure is, if we run into a situation where our ERT doesn't feel comfortable responding, then we've got a backup plan in terms of a national contract to have professionals come in.
all right, thank you, Sarah.
I don't really have much to add. I think Dan and Albert did a very good job, and Tom already describing. Yeah, I really don't have anything to add. It's all about frequency. Education is huge, and then making sure the supplies are available, which thankfully now that hasn't been such a challenge as it was in early March. So we've been able to keep everyone supplied with sanitizers and disinfectants that we need throughout the workplace.
Okay. Thank you, Dale. Anything you would like to add? And maybe a question coming up for you, Dale. Is there a particular sanitizing product that you use, or don't have to give name brands or something about that sanitizing product that makes it work for this particular coronavirus?
Yeah. So first of all, on the cleaning, we're doing a lot of the same things that the others talked about. One creative solution though that we did have that I should mention was we had the challenge with the door handles, doorknobs. We're cleaning those all the time, but there's a lot of door handles throughout the facility. So we looked at trying to prop the doors open wherever we could. We do have some limitations with our HVAC system and the airflows being a medical factory. There's a lot of requirements on there. So where we couldn't prop them open, we've hung boxes of tissues, a Kleenex box, next to every door handle. So if employee wants to, they can grab a tissue and use that to open the door in those spots. That's worked well. As far as cleaning supplies and types of cleaners, we've been very strict on that because we are a medical factory making medical supplies and regulated by the FDA. We have those strictly documented that only certain ones are approved to use. So we were reassured that those are adequate and are going to do the job of killing any traces of the virus on any of our surfaces. So we stuck with the cleaning supplies that we had been using and didn't go in and change those.
Okay. Stacey, would you like to add anything? And maybe there's something from the healthcare perspective on certain types of disinfectants to use.
Yeah, from the disinfectant perspective, we have to be very careful, like Dale was alluding to, that we're evaluating each of those. Sometimes you can cause more harm to your employee by not evaluating the disinfectant well enough. They can actually inhale it, or it can become aerosolized and have a negative effect on the employee. So I'm with Dale on that one. Be very careful on your selection. Don't just take the one thing you could get off of Amazon to get in to do your cleaning. Other than that, I don't have much else to add. We're cleaning lots of surfaces too, every solid surface pretty regularly. So,
is there an easy resource to go to find out what disinfectants you should use? Or something maybe?
I'll take a look in the handbook here that we provided you. We did provide a lot of references. I'll see if we have one in there for sanitizers.
Okay. While you do that, I think we'll jump to the next question. So this question is about, I know I've heard from a number of the industries that they're really comfortable about how they're handling this issue in the factory, but maybe more worried about what employees do outside the factory. So what messages are you communicating to employees in terms of safety off the job? And then we have a related question here on how are you encouraging social distancing outside the workplace that came in. So Albert, you're up first on this one.
Well, we've done a couple things, and really all these processes and procedures and practices that we're doing, it's really everybody's all in it together, and we've kind of incorporated that phrase that we see being used on social media as kind of the terminology that we're doing everywhere from leadership to employees. We're wanting to come up with ways to keep our employees safe. And so what we've done is early on, we developed an employee training program that talks about COVID protection methods back in March, and we rolled that out to all of our field service, project management, and general employees. It really stresses the practices and procedures that you need to do here at work, but also away from work, knowing that's a potential exposure for you. We've also made specific posters that are Daktronics specific, and we call them Steps to Protect Yourselves and Others from COVID-19, which talks about things to do here at work, but also away from work and how these practices You know, we talk about safety. Safety doesn't stop at the door. It needs to follow you home. And that's the same type of practices we're doing. So we really develop messages that hone on those requirements. We are also developing the CDC, and I think Dan said it, is every day there's something new and there's more resources that are coming available. The CDC now has a section on their website that talks about, they call it running essential errands. And so we're actually developing a training for our employees that tie into these running essential errands that talks about safety practices that you do out in the community. Then what we do is we can deliver them during tier meetings. We don't have big factory department meetings anymore, but our supervisors can help deliver those in those social distancing tier meetings. But then we can also roll it out to folks that are not based on campus through our learning center that gives them a narration of this presentation. So and then we also tie in our tier meetings these 8 steps that we came up in these posters can then become talking points each day, a different one each day. So it's not the same repetitive all the time. That's how we've been doing it now.
Yeah, thank you. Dan.
Same thing. You know, it's really about consistent and continued communication from our leadership team. Early on, as Albert had talked about, we had plant managers meeting with small groups in their facilities on a weekly basis. Then we went to every couple of weeks, and now we haven't done one for a few weeks because we just don't need to. So it's about educating people. We've done a lot of FAQs early on. Those have dropped off a little bit. And then I think the last part, and I already mentioned this, is that with everything being so unprecedented that we're dealing with, more often than not, we're probably being more clear than we've ever been in terms of making sure people understand that we expect them to do their part, and that it's not just at work, it's at home. And I made those couple examples where we really see people stepping up to the challenge. Just today, I talked to our North Carolina plant manager. He had 3 examples of people that had come to him and had plans for this weekend. One was going to the beach, one was going to an in-law's house, and one was going to take their mother home to Vermont. And that's what we want, and that's the behavior that we've generated. And could somebody do something? Absolutely. But you can only do the best you can. We're dependent on people to do their part. And again, it just takes one. And I think our employees know that.
Hey, thank you. Sarah.
You know, great comments from Dan and Albert. I would maybe just add to that, one of the things that we have begun to talk more about is these unprecedented times, the stress and the anxiety that everyone is feeling. They aren't getting a break from it on the weekends. So it's at work, it's at home, it's everywhere. And coming back to work refreshed on Monday isn't happening in the same way. So Kelsey talks about these virtual happy hours. We encourage employees to do those kind of things, and we try to arm them with some tools to find ways to still socialize, take a break, but doing it in a safe way, as Dan and Albert were describing. Hooking them up with tools, coaching them in that way, arming our supervisors and managers with the tools to include our mental health resources that we have as part of our benefits at Falcon. But really, and then checking in, we have teams now that are working from home. How do you stay connected? We do some virtual fun meetings with some of those teams. And in some cases, I've seen teams maybe connect, maybe even closer than what they did before when they're running around busy 5 different directions, just those times to check in. So I think even some of those little things during the week can really help your teams, both, as far as employees, but personally, to have that connection, to have some socializing, just to visit, check in, how is everyone doing, that you don't otherwise naturally get to do with some of your remote workers. And then helping to coach them on how they can get a break from all this, if you will, on the weekends, and just showing that genuine care that I know everyone has for each other right now.
Yeah, if I could just add real quick to Sarah, what you had said, that when I was listening to you, it made me think about, I mean, everyone on here, they're employees. Had we not been working, I guarantee that our people are so much well informed than I think they would have been by not working. And it's efforts like what Sarah explained, with taking care of your mental health, and Albert's talking about running of essential errands. I mean, these are things that I know we're doing, and listening to everyone else, I know you're doing every day to educate our people. And it's not just about keeping our businesses running; it's about their safety. And I love that one about taking care of their mental health. I think that's extremely important.
Hey, great. Dale, would you like to add anything?
No, I don't think there's anything left for me to add. Same thing.
Okay. Stacey, how about you?
Yeah, I think one of the components that is important to consider too is some employees just have a generalized fear. Of course, our employees are working inside the hospital, so we're encountering patients who are sick, and there is a level of fear. But the piece about returning home from work, and I imagine it is applies to many of your employees as well, is how do I return home from work? My kids are at home, they haven't been in school, and here I'm the only person coming in and out of the home. Should I do something different when I arrive at home? So there are some guidelines if you do have employees who are a little bit fearful about what's on my clothes, how to take your jacket off or where to hang it. That's important to consider. That fear might be there, something to ask your staff.
Yeah. Really quick question, or maybe two of them for whoever would like to answer these. One's fairly simple. Do you all have safety officers or directors that you run this through, or did you appoint someone specifically that didn't have that duty to assume this new task with the COVID issue? Whoever would like to take a stab at that one.
I'll just mention, as being the safety manager guy here, but there's a lot of really good resources, even for us safety managers, that can rely on. The South Dakota COVID hotline is an excellent resource. So I think one of our questions earlier was, how do we determine what restrictions this employee has, and how do they need to shelter in location? All those great questions. They are an excellent resource that all of us from a safety manager standpoint will rely on these external resources as well. I just wanted to mention that.
Okay. Other thoughts on that question? We had one other one that came in by email. I have to put my glasses on to read this. As you think about all these safety practices that you have implemented both on site and encouraging employees to stay safe off the site, do you have any thoughts on how you get back to normalcy? If we hit our peak here first week of June and we start talking about trying to open things back up, maybe August or whenever that might occur, how do you see yourselves changing going forward?
I'd just start on that one, because we've had a lot of dialogue on this, that we're not sure that we are going to change. Our fear is more of relaxing our standards. And I think one of the panelists had said earlier about we've got to, I think Dale, you said it, that we got to be constantly vigilant about what we're doing, because we don't want to relax, and we don't want any type of lessening of our guard and letting our guard down. And so right now, I think the things that we're doing, I'm not sure that they are going to change. And it was kind of interesting, some of the different barriers that we put up, that when people came in and we explained what we're going to be doing, but when they came in after a weekend and they see these different barriers, plexiglass, between workstations, and it was a little intimidating. And we found that people started to like it, so there's some things that we've done that have made people more comfortable in their jobs. So right now, I don't see us dropping back on what we're doing. Frequency of cleaning may change, I don't know, but right now we're going to hold this line for a long time.
Okay, any other thoughts on that question?
Yeah, kind of similar. We've actually extended our campus closure for employees who can work at home. Will continue to work at home through the end of May. And I think there's a lot of lessons that we learned and a lot of things that we learned that we're going to want to continue to incorporate and maintain in our systems that help us be more flexible, agile, and help us meet our customers' goals that we've actually learned through this process.
Okay. I'm going to jump to the next question. We've got about 15 minutes left here. So this question is about hiring practices. I know that we have 900 jobs open in Brookings right now. So obviously we have a number of employers that are still looking for workers, whether it's a seasonal employer or full-time employee. What are you doing to implement safe practice or safe hiring practices? And we start with Dan on this one.
Well, we have not done a lot of hiring at our facilities, mainly because we had a great staff going into this, and other than some additional absenteeism through leaves of absence of our COVID policy, we've been in good shape. We are going to start hiring here in Brookings very shortly, some seasonal people and full-time people. And we're still working on those procedures. But if you think about everything we've talked about here, that hiring practice, and if there's an interview, however those are done, we'll do them just like we do everything else in a safe way. So I don't have any specifics. We're just starting to ramp up on the need to hire.
Hey, Sarah, you're the HR expert in this group, I think. So
We've done some hiring and exclusively video and telephonic. A big part of our hiring process, though, that I think was the most difficult was you want to give employees an opportunity to really see where they're going to work, tour our facilities. So again, while this isn't perfect yet, we're still working to improve this, is giving virtual tours and just taking a walk. You know, we can use Zoom function just like this, and you know, it doesn't have to be fancy, is where we've kind of landed. You keep it real, you keep it casual, and you do those virtual tours by just walking through the different areas of your facility and talking about it. You're just doing it with a cell phone in your hand. So, and we found success. You know, I think going into it, we were like, oh, are we really going to be able to be effective with this? But the more we've done it, I think we've really gotten quite a bit more comfortable. The next piece that then we look at is that onboarding process. What does that look like? And we're still fine tuning that. Again, you know, you're used to welcoming them into your facilities and introducing them to everyone you can, but we're really revisiting that and pulling that back, and just for, you know, to limit the interaction, all the other things that we've already talked about from social distancing and such, but also revisiting that onboarding process and the interaction that occurs during that piece of it. Those would be the highlights, I guess I would share.
great, thank you. Dale, anything you'd like to add to this?
Yeah, you know, what a difference a month makes. A month ago, we were still way behind in hiring like crazy, and you know, 3-4 weeks later, we've took a pause now until we can figure out what's going to be happening here. So we've really slowed down the amount of hiring. When we were doing the hiring, we were doing everything we can to honor the social distancing, doing as much remotely as we could, keeping that 6-foot spacing. We stopped the tours and restricted the visitors coming in until they started. But one of the biggest challenges we've had that we still don't have the answer to is, how do you train a new employee 6 feet away on how to operate a piece of equipment when it's noisy? Even if you put masks on the trainer and the trainee, then makes it even worse, even though you're keeping them, you know, safe as far as, you know, the virus goes. But it makes training very, very difficult. And I hear about that one every day, and we haven't come up with the perfect answer yet.
Okay. Tom, any thoughts on this one?
We haven't done much hiring. I can only think of one instance. In that case, the managers that were doing the interviewing did not want to do it over the phone or electronically. They voted to bring the individual in just to get a better sense for the person. We did, you know, employ social distancing and things like that, but that's really the only change we've made.
Okay. Albert, how about hiring practices at Daktronics?
We've had a few people that we've hired on, and kind of like what Dan said, we're getting ready for the summer season. We'll bring summer interns on to work. We are doing all of our interviewing, like Sarah was mentioning, and screening all via telephone and Teams meetings or other types of meetings online. New hire orientation for our employees is also all online. But the biggest thing that thankfully we haven't done a lot of hiring lately, so we can work on this process, is what Dale just mentioned too, is how do we train our employees on the production floor so that they understand the process to be able to do it safely, meet our quality guidelines. So we're working through that. We're looking at a couple web apps that actually are more like a virtual application that one person can look at it while the other person can scribe on it. That might be something that we look at in conjunction with all of our developed trainings for equipment and processes already. But that is a big challenge that we all have. The ones that we've been doing is more the step in, step out technique. I step in, I demonstrate what needs to be done. I step out, I let the other person come in, and even that has challenges with elevated noise areas and comprehension.
Okay, thank you. Stacey, anything you'd like to add to this question?
Just one technique, and you hit on it a little bit with some of the virtual training, but we've done a little bit of virtual training or interactive training. Some of that comes out of the trying to conserve PPE. So we don't put PPE on just to train people how to put it on. We actually have some interactive computer model that you can do that training with. So different things to consider.
Okay, thank you. Well, I have one more question left, and we have about 7 minutes to go. So I think that I might just throw this one out, and we'll see what kind of answers all of you can provide. So you're all fairly large industries, at least 100 employees and above. Do you have any words of wisdom on how you could take these practices and implement those in a small business that maybe has a half a dozen employees? Any thoughts? I think a lot of this should be transferable, but at the same time, how would you go about this as a small business?
Maybe I can give my 2 cents on this. I think a lot of everything that we're all talking about shows the first thing is dedication. You have to have dedication to the cause. And what is the cause? The cause is protecting the employee safety and well-being of them. And really the things that you look at on getting that buy-in from leadership, but then also with anything that you're doing is really you're needing to change the behaviors of your team. So it doesn't matter if you're a large employer or a small employer, is identifying the behaviors that you want your team and your management and your staff to follow. It's the social distancing. It's thinking about how do we protect those employees for those processes to push the 6 foot. It's the personal etiquette. It's the staying home when ill. It's all the behaviors that we really need to focus on. And if we can focus on the behaviors, you can take any one of these programs with that leadership and implement it in your factories. But that would be my guidance on that.
Great advice, Albert. Anybody else like to offer anything on this one?
I would just add to what Albert said is, start simple with the CDC came out with directions for all of us. I talked about personal hygiene and, distancing. And then, as Albert had said, and we've talked about in this discussion, it's really about constant communication and being relentless. And it's interesting that our approach, and as a small business, this is a little bit more of a challenge. I'm really fortunate to work with a great group of people, and we established a crisis management team. And as we talked about these different steps that we're going to put in place, we didn't always agree. Matter of fact, we rarely agreed, but in the end, typically what we disagreed on is how much is enough and how much is too much. And that's the toughest thing, I think, as a small business owner that you would have to go through, because if you start simple and then you try to apply it in your business, that's where it becomes challenging, because again, you don't want to go too far and you don't want to stop too short. And I think you engage your people, you develop the procedures together, and you just relentlessly, you got to stay on top of it.
Great. Any other comments from anyone? Well, I've run out of questions. It sounds like maybe you've run out of answers. So, and we are nearing our time to quit here. So again, I want to thank everybody, all the people that joined to listen into this conversation today. I think it's been a great conversation. Really good panelists. Appreciate so much the answers that you have provided to the questions. Lots of good insight there that can be taken back to other businesses to deploy to keep them safe as well. So thank you again for taking the time to come and participate in the webinar today. And we'll all hope that this goes away sooner rather than later so we can get back to whatever that new normal is going to be. So we'll sign off there, Kelsey, if you're still there.
Thank you, Al.
Yeah, thanks everybody.
Thanks, Al.
Kelsey, are you going to close this meeting out? He says, great.
Can you hear me?
Yes, yes.
I don't know how to bring my video back on the screen, but thank you guys so much for participating. Thank you for the attendees. We really appreciate all of this. We're gonna get the recording out to attendees. I did have a glitch in my internet about halfway through, and I'm hoping to God that when I get off, it still has the full webinar. So say a little prayer real quick for that. But thank you all. We hope you enjoyed it and learned a lot, and we will hopefully see you all soon.
Great, thank you. Well, I'll click the leave meeting button so you're all off the hook now. Thanks again, everybody. Appreciate it. Stay safe.
Great work out there.
Bye.